Proper care of newborn calves is critical for their long-term health and survival. The first step is to ensure that newborn calves receive at least 3 litres of colostrum, ideally in the first 2 hours of their lives. In this film, part of Dairy Co.'s calf management series, we're going to look at how to safely administer the colostrum to a calf by a stomach tube. I'm here with Dairy Co.'s Extension Officer, Nicola. Nicola, under what circumstances would a stomach tube be used?
Well, the best way to administer colostrum to a newborn calf is with a bottle and a teat. But if the calf can't suckle, the next best way to give this colostrum is by stomach tube. Being able to do this properly can be life-saving, so it's important that everyone involved in the care of the calf is trained in when to use a stomach tube and can do so confidently and safely.
In this film, we're going to cover the preparations you should make before beginning, how to handle and restrain the calf, how to insert the tube and make sure that it's correctly placed, how to give the correct amount of colostrum at the correct rate, how to remove the tube safely, and finally, a reminder on the importance of effective cleaning and disinfection of equipment.
The first step is to assemble the equipment you need. A stomach tube, colostrum warmed to 38 degrees centigrade at the time it's going to be fed to the calf. You'll need at least 3 litres of colostrum per calf. You'll also need a pen or tape to mark the tube. All equipment should have been sterilised and be in good working order. This means no sharp edges. Damaged tubes or disintegrated teats can harbour bacteria, making them difficult to clean. Sharp edges can damage the inside of a calf's mouth, leaving it susceptible to infection. It's always worth having a clean, spare tube handy, just in case. The next step is to handle the calf correctly. Make sure you've selected the right calf and take care if there are other cows and calves in the pen. An easy way to handle the calf for both you and the calf is to back it into a corner and place your hand under its muzzle to keep its head and neck upright. This prevents the calf from backing away and the tube is introduced. If the calf can't stand, do the same thing from a kneeling position with the calf's front legs folded and the head up. You must support the head. Never tube a calf that's lying down flat, as this increases the risk of the milk entering the lungs, which can cause pneumonia and even death.
Correctly positioning the tube is crucial. The tube needs to pass down the calf's esophagus into the abomasum, also known as the true stomach. The entrance to the calf's windpipe and esophagus are found very close to each other at the back of the mouth. It's important to be sure that the tube has passed into the right one. If the tube is accidentally passed into the windpipe, the colostrum will enter the lungs. Milk should never flow down the tube until you are certain that it's correctly positioned.
Before introducing the tube, it's important to check what length of tube you need. This is to ensure it reaches the calf's abomasum. For each calf, you should measure from the point of the nose down to the point of the elbow just behind the front leg. This should then be marked with a pen or tape. Before you introduce the tube, moisten the end with colostrum. This will make it slippy and easier to pass. In cold weather, the tube can become very rigid. If this is the case, warm it in some warm water and this will make it easier for the calf to swallow. Gently raise the calf's head and squeeze the side of its mouth to open it. Slowly introduce the tube to the back of the mouth. The tube should slide down one side of the mouth rather than directly over the tongue. Wait patiently and be gentle at this point. The chewing movement made by the calf will help the tube be swallowed down the esophagus. If you feel resistance, stop immediately. Pull the tube out slightly, redirect and try again. The tube should never be forced. Once the calf swallows the end of the tube, gently slide the tube down the esophagus until the mark on the tube is level with the calf's nose. When the tube is in the right place, the calf should seem reasonably comfortable and be swallowing. If the calf starts coughing and puffs of air can be felt at the end of the tube, gently remove it and wait until the calf recovers and is breathing normally before reinserting the tube at a slower pace. Before you administer the colostrum, you must check the tube is in the right place by feeling on the left-hand side of the neck. You should feel 2 tube-like structures.
The windpipe is firm and has raised rings or ridges. Above this is the esophagus, which is a soft, collapsible structure that normally can't be felt. When the tube is in the correct place, it will be felt as a smooth, hard structure through the wall of the esophagus. You should be able to feel 2 hard structures. If you can only feel one, it's likely you're feeling the windpipe and that the tube is in the wrong place.
Once you're happy with the location of the tube, you can start to give the colostrum. The colostrum bag should be raised above the calf's head to allow it to flow by gravity. You can control the speed the colostrum flows by raising and lowering the bag. Always support the calf's head with your other hand. Feeding the colostrum at a slower speed will help the calf regurgitate less. If the colostrum is fed too quickly, there is a danger this regurgitated liquid could be inhaled. You can expect some wriggling as the calf's stomach fills, but the calf should not be coughing. The tube shouldn't be removed until the colostrum has finished flowing and there is none left in the tube. If you remove the tube before this, the calf might inhale the colostrum. The tube should be kinked or clipped off and removed in one swift movement. Kinking stops any colostrum remaining in the tube from entering the windpipe when it has been removed. The feeding tube should be cleaned thoroughly, then disinfected immediately after use. This is important as any residues left provide a breeding ground for germs, and the next calf tubed could potentially receive a large dose of harmful bacteria.
So the key things to remember are: be prepared with clean, undamaged equipment. Position the calf with its head and neck upright. Introduce the tube patiently and gently. Check the tube is positioned in the esophagus. Administer at least 3 litres of warmed colostrum slowly, and then kink the tube on removal to prevent inhalation.
Tubing a calf correctly is an essential skill to know, as it can also be used for scouring and dehydrated calves that need to be given electrolytes. The skill is also transferable to adult cattle that may need to be given electrolytes orally through a tube and a pump.
You can find more information about caring for newborn calves on the Dairy Co calf management fact sheets or through the Dairy Co website.